ask you a serious question. If I ask you what your sugar level is, would you have known? Most people don't, and yet millions of people are walking around with dangerously high blood sugar, feeling perfectly fine until complications suddenly occurs. In this video, I'll be explaining blood sugar in the simplest possible way, what the number actually means, and why knowing your blood sugar level can protect you from diabetes, the heart disease, and even organ damage. Stay till the end. This information could change how you see your health. Hi guys, welcome to my YouTube channel. This is your first time coming across this channel, the Health Podcast. Please subscribe, share, like, and comment on our video. In today's podcast, we'll be talking about blood sugar. Blood sugar, knowing your blood sugar, the numbers, and why it is important. As you all know, blood sugar is also known as the blood glucose, which is the amount of sugar circulating in the blood, Your body actually uses glucose as its main source of energy, and each time you consume carbohydrates like rice, garri, bread, fruits, and even sugary drinks, your blood sugar level rises. Insulin is actually an hormone secreted by the pancreas, and what it does is that it helps move the sugar or the glucose from the blood from your blood to your cell. And when this system works perfectly fine, the blood sugar maintains a healthy range. But when it doesn't, that's where the problem then begins. Now let's talk about the number, because this is where confusion usually starts. A normal fasting blood sugar is actually below 100 milligrams per deciliter. Pre-diabetes is when the fasting blood sugar is between 100 milligram per deciliter and 125 milligram per deciliter. Now then, diabetes is diagnosed when the fasting blood sugar is above 125 milligram per deciliter, and it is confirmed in two different tests. What I actually mean by that is that when you run a test and they said your sugar level is above 125 mg per dl, you should try and confirm by running another test, by running another test, maybe in same place, or you visit another medical center to confirm it. There is also another test called the HbA1c. This test shows your average sugar level in the past 3 months or in the last 3 months. Shows your average blood sugar level in the last 3 months. An HbA1c below 5.7% is normal. Between 5.7% and 6.4% is pre-diabetes. Then from 6.4% and above 6.4% is diabetes. These numbers are not just statistics, they represent real risk. I know you would also want to know why high blood sugar is dangerous, and here is why. In the early stage, you may feel absolutely fine, no pain and no warning sign, but inside your body, high glucose level is silently damaging your blood vessels and nerves. Over time, this can then lead to heart disease, stroke, kidney failure, vision loss, nerve damage, and even erectile dysfunction. Many people are first diagnosed after complication appears. That is why screening is not optional, it is essential. I know the next question you want to ask is, who then should get screened? My dear, people actually think diabetes only affects older adults, but that's not true. You should consider checking your blood sugar if you are over 30 years old, you have a family history of diabetes, you are overweight or physically inactive, you have high blood pressure or high cholesterol, you experience frequent thirst, urination, or fatigue. Even if you are healthy, you should consider screening, because it helps detect problems earlier and when they are easier to manage. You want to also know if blood sugar can be controlled. Yes, my dear, blood sugar can be controlled. Management involves 3 pillars. First is your lifestyle changes, which involve healthy eating, physical activity, weight control, and sleep. Then the second management is regular monitoring. That is to know whether your plan is working. Then the third is medication when prescribed by an healthcare professional. As someone trained in pharmacologist, let me emphasize on this. Medications are effective, but they work best when started early and used consistently. So my dear, ignoring high blood sugar level does not make the problem disappear. Here is my prevention message to you. Prediabetes is not a life sentence, neither is it a certificate to death. With early detection and proper lifestyle modification, progression to diabetes can actually be delayed or even prevented. But here is the problem: you can't prevent what you don't know. That is why knowing your numbers matters. That is why knowing your blood sugar matters. That is why getting screened matters. That is why going for regular checkup matters. Blood sugar problems do not start overnight, neither do they announce themselves. This is why knowing your number gives you control over your health. And if this video helps you understand blood sugar better, please give it a like and drop a comment below. Subscribe to our channel for evidence-based health talk and share this video to someone you care about. This might save a life. Know your numbers, get screened, and please subscribe, please, I beg, subscribe. Thank you.